Welcome back, everyone. TV6 continues to investigate the rising costs of healthcare in Upper Michigan. In our final part of this series,
TV6's Vinny Lavia joins us live to explain some solutions that could lower costs and raise the quality of healthcare you receive. Vinny, fill us in.
Grace, Brady, in the first two parts of this series, I explained some of the reasons behind why you're paying more for a visit to the doctors or the hospital. Now in this third and final part, those I spoke with tell me that more stringent regulations for healthcare companies are key to raising quality and lowering costs. Private equity putting profit above patients, buying an increasing number of healthcare systems nationwide, overburdened clinicians who say they feel unappreciated by healthcare executives. These are some of the issues healthcare workers and stakeholders told me are directly impacting all of us. So what's the solution? Mary Bugby with the Private Equity Stakeholder Project says it's more regulation.
We need more eyes, we need more scrutiny, we need more information about the financials for private healthcare companies. And we need just more action on the part of regulatory agencies tasked with regulating them to actually hold them accountable when they do break rules. But those rules have to be there in the first place, and we just don't have enough right now.
Bugby adds that hospitals should also be required to provide certain services for patients.
If a hospital has a license to operate, they should have to offer a basic package, like a minimum package of services. That should include labor and delivery.
UPHS Marquette says keeping healthcare workers in the UP to provide all of these services is easier said than done. The hospital adds industry pressures like supply chain disruptions, a shrinking clinical workforce, and declining reimbursement often are felt more acutely and can be tougher to navigate in a rural market like ours. But Sarah Trudgeon, the Michigan Nurses Association president at Aspirus Ironwood, says competitive pay raises would keep more workers here, adding that executives don't always agree to these terms with workers.
When you go into these negotiations with these executives, what do they give you reasons as to why you can't be paid above a certain amount, or why they maybe can't bump your pay?
Honestly, I don't believe that they ever give a reasoning on why we don't have the competitive raises, and it's just kind of been that's not really happening.
Trudgeon says many of the employees at Aspirus Ironwood are part of the MNA union, and without this, their wages would likely be lower.
Right now, with our contract and everything, we not only with our pay scale, there's other things with PTO, vacations, and things like that. But we have guaranteed raises each year because of the union and our bargaining. And without that, we would go to a different scale that you would never have a guaranteed raise, pretty much. So the union gives us more power in our hands on that aspect.
So do you think that a lot of that would go away without the union?
Yes.
Both Trudgeon and Bowman tell me keeping high-quality healthcare workers in the UP comes down to communities supporting, preserving, and bolstering unions. Bowman cites last year's MNA contract dispute between workers and executives at My Michigan Sault Ste. Marie.
They had a strike recently in their campaign, and they were able to fight hard and make big improvements for themselves and for their patients.
Bowman also cites the ongoing effort by the MNA to regain health insurance losses for union employees, which he says has gotten worse due to LifePoint. In December, the MNA claimed the healthcare provider recently violated Mast's contract by implementing health insurance that costs employees more and offers less coverage without proper notice just before the open enrollment period.
We want them to fix these mistakes that they've made. We're seeing all these erroneous charges. There's all this chaos and confusion about what's even happening with our plans. We've had individuals told that they don't have coverage when they've tried to use it. If we did our jobs to this standard, people will be dead.
UPHS Marquette responded in part, "We are working with LifePoint and the MNA to find a solution that ensures consistency and compliance with our agreements and put safeguards in place to prevent this issue from happening again. You can do your part to help combat these issues." Trudgeon adds that many hospitals will ask you to review them after visiting. She encourages you to leave an honest review, which helps administration see what they're doing right and what needs to be improved.
If patient starts, explaining their experiences they're having, and that would get to more executives or management about what's actually happening, just coming from a patient aspect, I feel like that would be big.
All those that I spoke with, including Trudgeon, say change is possible, but only if community stakeholders get involved and support their local healthcare workers. They remind you that all of us can benefit from high-quality, affordable healthcare. And if you want to see more stories from TV6 Investigates, you can watch them on demand. You can find all of our previous stories, including the 2 in this series, on the TV6 Investigates tab on UpperMichiganSource.com. You can also find the category on our free TV6 Plus streaming app. Grace, Brady,